Hello, everyone, and welcome. Thank you for joining us in our session today on behavioral science and administrative burdens. My name is Mary McLennan. I am the Senior Advisor on Behavioral Science to the Executive Office of the Secretary General. I also lead an initiative called the UN Behavioral Science Group, and we're very excited to welcome you today to another session of UN Behavioral Science Week. So if you haven't seen the agenda already, I encourage you to check it out. We're just on the second day. There are a few more days to go in terms of events ranging from health, climate, peace, and security. So no matter where you're trying to explore behavioral science from, which angle, there is very likely a place for you in this agenda. And we'll include the links in the chat shortly to the agenda if you haven't seen it already. So I also wanted to mention a little bit about the UN Behavioral Science Group. As I mentioned, it's an initiative that I lead. It's an initiative of the UN Innovation Network. We bring together over 1,000 UN colleagues from more than 60 entities in 110 countries. So it's quite a big and growing group. We currently range not only across geographies, but also with respect to different domains and areas of work, ranging from, again, health, climate, gender, peace, and security, lots of areas. And we also range with respect to our experience with behavioral science. So although there are behavioral scientists in the UN, and we'll hear from one today, many colleagues in the group are very much at the early stages of their journey, thinking through how to apply behavioral science in one project or in a pilot. So no matter where you are, though, along the spectrum, there's a space for you. And again, in the chat, there'll be some links to join the group if you haven't done so already. I also wanted to flag that behavioral science is also of importance at senior levels of the UN. Particularly, the UN Secretary General has called it a critical tool for the UN to progress in its mandate, and also encourages entities to work together to promote behavioral science, which is what we aim to do in the UN Behavioral Science Group. So I'll just say here that if you want to check out the links for more on the agenda and the week, and happy to answer any questions about the group that you might have throughout the session. Speaking about questions, before we get started with today's content, I wanted to share with you a bit about how we're hoping to run this session or planning to run this session. So we'll hear from a number of speakers, and then we'll open it up for Q&A at the end. We encourage you to put your questions in the Q&A box. And there you can also upvote the questions of your colleagues. So keep that in mind throughout the session, and we'll monitor that throughout as well. Okay, so now on to the content of today's session. So we're very fortunate to have with us today Professor Elizabeth Linos. She's at the Harvard Kennedy School. She also runs an initiative called the People Lab, which we're very excited to hear about today. In addition to her work in academia, she also has an extensive experience working within public sector in a variety of areas. She's been a VP and the head of research and evaluation at the Behavioral Insights team in North America. She's also worked with numerous governments in the US and the UK, and even the Greek government as well. So with that, I'll turn it over to you, Elizabeth.
Thank you so much, Mary, for the introduction. And I'm so excited to be here to talk about what I think might be my favorite topic to talk about. So let me share my screen and then we can get started. So I'm really excited to talk to you about how we at the People Lab are thinking about this question of administrative burden and behavioral frictions. I'll tell you a little bit about the lab and then just give you some examples of these projects, but I'm also eager to hear your questions during Q&A. So just as an overview, the People Lab is a research lab that I lead at the Harvard Kennedy School. And the goal of the People Lab is really to empower the public sector by producing cutting edge research on the people of government and the communities they're called to serve. So we're really focusing on using tools from behavioral science and public management, not only to nudge outwards, but also to think about internal government operations. We work in three big areas. I'll focus more on some today, but just to give you an overview, the first bucket of research that we work on is on strengthening the government workforce. So we think a lot about how to recruit, retain, and support government workers. We have a second bucket of research on how to improve resident government interaction. So we're thinking a lot about how to make it easier for people to interact with the government, especially when it comes to reducing the barriers that people face when they need to access programs or services. And we have this third bucket of research that tries to take a step back and reimagine what it even means to do evidence-based policymaking and think about that as a behavioral question. So how do we make it easier on the front end to make sure that the right people are in the room when we are designing new programs or new services. And also on the back end, when we have evidence, when we know that something works, how do we make it easier for that evidence to be adopted by policymakers? So if you're not new to the concept of administrative burden, you'll probably see that in each of these categories, whether we're talking about internal government workforce challenges, or we're talking about how to deliver better services, or even how to increase adoption of evidence, there are administrative burdens that people face when they're trying to improve outcomes. And those can be informational, so knowing what the program is, knowing what to do, knowing what services are available. The barriers could be compliance burdens or logistical hurdles, the numerous ways in which we create red tape or make it difficult for people to access both internal operational services as well as external services. Or it could be about psychological burdens. And the examples that I'm going to point to today are going to talk about different types of burdens. But across these categories, we can think about administrative burden as a conceptual framework to try to figure out, what are the burdens, what are the barriers that people are facing, and how can we tweak or change existing programs and services to take away that burden or to take away that hurdle. So let me give you a first example of work that we did during the pandemic. So one of the big challenges in the US social safety net, as many will know, is that there are so many people who are eligible for government benefits and programs, but only a subset of people are actually able to access them. So across programs, that's somewhere to 20 to 50% of people who are eligible for government programs, but are not accessing them. And there's many reasons and many studies we could talk about that focus on the administrative burden of taking up these programs. During COVID, one of the big challenges that emerged was a huge influx of people who were newly at risk of being evicted or at risk of not being able to pay their rent. And luckily in this situation, the US government poured millions of dollars into local governments to be able to provide rental assistance. And so for the first time in probably a generation, the challenge of local government is not that there's not enough money. There was enough money being dispersed, but people were not taking up the program at the rates that were necessary. So at the beginning of the pandemic, money was there, take up was low. So this is a very typical case for trying to think about administrative hurdles. So what we did is we worked with two cities. I'll show you the work from Denver, but we replicated it in Austin, Texas as well. And we collaborated with the Department of Housing Stability to think about ways that we could try to unlock some of those barriers to try to increase take-up. In this case, we were really focused on both informational barriers, making it easy for people to know that the program exists, but also psychological barriers. So the stigma associated with trying to access housing assistance, which is a huge challenge in the US. The reason we focused on those barriers in this example is because the city itself had already really tried to reduce the compliance burden. So a lot of work was already happening to try to make it easier for people on the logistics to be able to access these programs. So what we did is we sent people postcards to their home that look like this, and they say, are you struggling to pay your rent? You're not alone. And it's very specific in explaining what the program is. You'll see the logos of the nonprofits that were collaborating with the city government to do it. And on the back end, in true behavioral science, we have kind of very simple calls to action. If you want to apply, you either call this number or go online, and we have a quote. So this is kind of a typical behaviorally informed intervention that tries to target information costs by not waiting for people to go to the website, but sending information to their homes. What we were particularly interested, as I mentioned, is seeing how the word choices we made were able to either unlock or further the psychological burden of being eligible for this type of rental assistance and accessing it. So we sent two versions of the postcard to different households. One version was the one I just showed you, and just so that you can kind of see the differences in the language because they're very nuanced, I'm showing you the differences here. So one version said, are you struggling to pay rent? You're not alone. The other version said, are you struggling to pay rent? You're not alone, and it's not your fault. Because of COVID, you might need help. So we're really trying to reduce the shame associated with needing help at this point in someone's life. There are other small changes that you'll see. So rather than saying if you're eligible, we said all eligible residents can receive an application. Rather than saying a staff member will determine if you're eligible, we say a staff member will help you determine if you're eligible. And each of these changes are targeting a part of what we think is the stigma associated with government assistance, really trying to put the autonomy and the dignity back on the resident so that they don't feel like they're being judged by the city employee, that, you know, they're just able to access these programs as eligible residents, and the city employee or the nonprofit is there to help them do that. So what you'll notice that these are very slight changes, but what we find is that these changes make a really large difference in terms of actual take-up of the program. So I'm showing you here application requests, which was the actual call to action, but I could have shown you actual applications, funds being dispersed. Across the board, we see a significant increase of just reducing that information barrier. So just giving people information, and an even larger increase in applications if you use the destigmatizing postcard. So that's about a 40% increase in applications just by using, you know, slightly targeted language and a postcard that is a very light touch or low cost intervention. Another thing that we found that was interesting in this case, and this is just exploratory, is how changing the language to reduce these barriers also changes who participates. So what we find is that in the control group, about 5% of households that applied for the program were Black and Brown, Black and Hispanic. But in the destigmatizing postcard, so amongst the people who applied, 26% were Black and Brown if they received the destigmatizing postcard. So we're seeing something that's just exploratory at this point, but is showing a shift in the demographics of who takes up programs based on these reductions in administrative burdens and the information costs and in the destigmatizing intervention. Here's a second example that goes a little bit to the operations of trying to use evidence when you're a policymaker. So one of the challenges that we've seen in a bunch of different projects is that we spend a lot of time correctly evaluating the impact of a specific program or a specific behavioral tweak. And then we find out what works, we get excited, we present the results, and then we kind of move on to the next thing. And one question that emerges for those of us who are interested in policy impact is what happens next, right? So what happens after you've run your behavioral test? So what we did in this project with Stefano Della Vigna and Woojin Kim is we followed up with all the cities who had ran these rigorous evaluations, randomized controlled trials with the behavioral insights team between 2015 and 2019. So in some ways, this is the perfect sample of cities in the US that are excited about evaluation and are excited about behavioral science because they themselves have run trials in their own context. And what we see 5 years later is that even though about 78% had positive results available to them, and even 45% had statistically significant positive results, the adoption rate is about 30% later. So the use of that evidence 5 years later is about at 30%, which, you know, is pretty good depending on who you ask. What's perhaps most interesting is what predicts whether or not that evidence is used. And I think here's where the behavioral frictions play an important role. Unfortunately, the strength of the evidence does not seem to be a predictor of whether or not that evidence is used. And kind of traditional measures of state capacity or the topic or the nudge don't seem to be predictors. The one thing that I thought was going to be the main predictor is whether or not staff remain in their positions. And we see that's directionally true, but not as predictive as we thought or as other people forecasted. And in fact, the strongest predictor of whether or not this innovation or this tweak gets adopted is actually whether or not it was building on a pre-existing communication infrastructure. So when you tweak language of an existing letter, you're much more likely to have that adopted and sustained over time than if your innovation is something that requires a whole new communication infrastructure. So what that points to, at least from our perspective, is this idea of organizational inertia. When there's an infrastructure in place that allows for communication to go out, we can test things and tweak them and they get adopted. But how to get rid of that organizational inertia or how to build around it so that evidence is adopted regardless is really an open question and something that we'll be studying in the next few years. So let me quickly sum up to just mention topics we're talking about now or working on now. You know, one of the big areas that we're working on is how to make it easier and more attractive for people to enter the public sector. Those of you who are in the public sector will know how administratively burdensome it can be to figure out if a job exists and if you're eligible to go through the compliance hurdles of actually applying and persisting through a selection process. And of course, there's a whole bunch of psychological barriers associated with applying to government work. And so we're testing different ways to do that. We're continuing to do work on how to better understand and reduce the administrative burdens of the social safety net in particular, not just on the demand side, but also on the supply side. So we're thinking a lot about how to destigmatize government benefit recipients from the perspectives of landlords or frontline workers. And then this third question, which is this kind of bigger behavioral friction question, what would convince a policymaker to even adopt evidence? How can we make it easier and more streamlined for people to adopt evidence when it exists? And those of you who know me will know that my secret cunning plan is to really create a whole new generation of scholars who don't choose between doing rigorous research and social impact, but are really able to do both. And to really make the case that if we are doing our job well as researchers and academics, the questions that we're answering are questions that government agencies have asked. So I'll stop there and say thank you, and I look forward to our Q&A and the panel.
Great, thank you very much for that, Elizabeth. Lots to explore there. Definitely aligned with the way we work in the UN, engaging with academics who are working on real questions. So thank you for sharing that and for promoting that within the academic community. Okay, so I have a quick question for you before we get to our panel. So has your team looked at administrative hassles faced by public sector workers? So particularly in the UN, we're aware of colleagues reporting pretty high levels of internal administrative hassles. And so we'd be really keen to learn if the People's Lab has done anything to look at to what extent do they exist and what impact they're having and what we can maybe do about it as well.
Yeah, it's a great question, Mary. Part of the reason I started the People Lab is because when I worked in government, we had so many smart people thinking about policy design and policy reform or public sector reform. And I felt like we didn't have enough researchers thinking about how that would impact the public sector workers themselves. So we have all these cool, innovative ideas, but how does it affect the day-to-day experience of being a government worker? And that's really where the People Lab started. So the answer is yes, we do think about that a lot in a couple of ways. So one is on the recruitment side. We've done quite a few studies that look at the administrative burden of recruitment and selection processes. I think there used to be this belief that if you work in government, you do it for pro-social reasons, and therefore all these hurdles are just screening mechanisms to screen out people who aren't truly motivated. But in fact, what we see in our research is that actually you're screening out the wrong people. You're screening out talent if the process itself is really, really burdensome. And so now we're doing some studies to try to reduce the administrative hassle of actually getting a job in government. And then when we work with people who are currently in government, it often comes up when we talk about emotional exhaustion and burnout. And so there's a conceptual framework called the Job Demands Resources Framework that talks about how job demands can really link to emotional exhaustion and ultimately burnout and turnover. And sometimes those things are filling out a lot of forms and not feeling like you see the impact of your work and having lots of emotionally draining conversations with frontline staff or with residents, or ways in which you have to make decisions without having information. All of those job demands are very critically linked to a critical outcome that we care about, which is absenteeism and turnover of staff. So we're doing a lot of work to kind of buffer against those risks with peer support interventions, with social support interventions, and we do see that it can make a difference. So we can reduce burnout and turnover when we try to buffer against those job demands. But those job demands are real. So oftentimes our solutions are band-aids for a bigger systemic challenge. So I'm super excited to hear how the UN is working on the fundamental systemic challenges associated with this issue.
That's fascinating. I've so much to explore in this one point. I think I will refrain from asking a follow-up question and commenting beyond that. Thank you so much for that. Elizabeth will stick around through the session. She'll be with us for the Q&A at the end. So feel free to put your questions in the chat and we can come back to them after. Thank you so much, Elizabeth. I'm going to now introduce our panel, who's going to speak about some of the UN experiences addressing some of the issues that Elizabeth has just mentioned. So we have with us 4 speakers and then a very quick panel we'll have. So first we have Lucy Martin, who's been with us as a UN Behavioral Science Fellow over the last while. So if you're a part of the opening session of UN Behavioral Science Week, you've probably heard about the UN Behavioral Science Pilot Fellowship. So Lucy was one of our first cohort, and she'll speak to some of her work doing this. She's currently a postdoc at postdoctoral fellow at the University College Dublin. We'll also hear from Tasnia Rahman from the World Bank's Mind Development and Behavior Unit. Her work focuses on a wide variety of issues when it comes to behavioral science, but more recently has been on gender. And then we'll hear from Daniela Wirtz, who is currently the Chief Business Analytics and Compliance at UN Peacekeeping. She's previously worked at the UN Secretariat and will be speaking to some of the work that she carried out there. And then finally, we'll be hearing not from Shasha today, but one of Shasha's colleagues from Zabib, who's a human resources officer within the Food and Agricultural Organization, and she focuses on social security. So with that, I'm going to stop sharing slides and turn it over to Tasmia, who will kick us off. Over to you.
Thank you so much, Mary. Let me share my screen first. So can you see my presentation?
Yes.
Great.
Perfect.
All right. Well, thank you so much. It's a pleasure to be here and to also hear all the fascinating work that's happening, especially at the UN as well as outside. So today I'll talk about a project, one of our projects with the Department of Social Services in Bangladesh, which is the entity that is in charge of the major cash transfer programs in the country. And our objective at the start of this engagement was really to improve the local service delivery in whatever way possible, but of its three major cash transfer programs, with this happening in the context of a very large scale cash transfer digitization project that was being supported by the World Bank. So as you can tell, our objective was very broad, and that's why we started off with a very open slate and a very detailed diagnostic process, which is what I'll focus on a lot today. And this included kind of qualitative fieldwork, quantitative surveys with social workers who are the organization's foot soldiers on the ground, and in charge of implementing all of these programs, and some very small sort of mini pilots or A/B tests to try out different solutions before we decided on kind of a single intervention that we wanted to test at scale. And this diagnostic process was very helpful because it helped us identify some of the major challenges that these social workers were facing that affected their ability to deliver these programs more effectively. So the first one, I mean, there were lots of challenges. I'll focus on a few that I think are relevant. The first one is around time allocation. What we found was that these social workers were not using their time as efficiently as they should, and a relatively small kind of microloan program, which involved lots of repetitive paperwork, client visits, was absorbing nearly half of their time, even though it was a very small portion of their actual work, and left the social workers with much less time to focus on the cash transfer programs that actually needed their effort. In addition to sort of the time needed, it also added the psychological burden due to the effort they needed to make this program kind of function effectively. So we also found that as a result, and also related to various other things, motivation and job satisfaction were also affected by the workload, lack of appreciation and recognition, and just kind of low salaries and other common things you kind of see in government, in a lot of these government positions. So as a next step, we tried different solutions. We in fact tried 4 different solutions, mostly using very small scale pilots or A/B tests with like 30 or so social workers. While most of these are very small pilots, the results are at most indicative, if not even that, I would say. But we found the process of trying out and getting qualitative feedback on each of these steps and pilots to be very informative, both for the purpose of eventually designing our own intervention, but as well as generating ideas and lessons for the government and the organization to consider in the future. So the first 2 pilots we did were focused on reducing administrative burden, exactly, and particularly of this microloan program that I mentioned earlier. One of the first things we tried was simplifying one like very long and tedious form they have to kind of fill out every day when they collect a repayment from borrowers. So we reduced the number of fields they needed to manually enter, added a carbon copy option to minimize the time spent in kind of filling out this information. And this ended up saving over 40% of the time that they were spending on these receipts, which translates to about 2.5 hours of time every month, which is small, but it left the workers much happier and less frustrated with kind of things that they didn't find particularly enjoyable to do before. The second pilot used a very simple but salient sort of nudge with a carrot and stick principle. What we did was make late payments from borrowers more salient by giving them a green sticker on their payment, on their sort of payment receipt if the payment was on time, and a green sticker if the payment was on time, and a red sticker if the payment was late. And there was no explicit sort of penalty for late payments here, but the visual reminder of being a good borrower or a bad borrower was meant to sort of nudge them to make timely payments in the future. And what we saw was, slightly over 7% reduction in late payments for the social workers who did use this, and it improved repayment collections, of course, but also saved the workers almost 10 hours of time kind of each month that they would have had to spend kind of tracking down these borrowers, repeated visits, and so on. So we also tried 2 additional pilots that were focused on improving motivation and job satisfaction of social workers, which we found to be a challenge. One was a very large survey experiment we did with almost 1,000 social workers on self-reflection, where some of the workers were asked to reflect on the organization's mission and their sense of belonging, while others reflect on the positive aspects of their jobs. Now, this had mixed results, so we didn't find this to be particularly promising. But a second mini pilot we did was we invited social workers to submit kind of a special story, either written or in video format, featuring a beneficiary or a client they work with and how they've helped them. And the best storyteller would be selected by the supervisors to receive some kind of a non-monetary prize for this effort. Now, this didn't work well because of low participation, challenges in submitting some of these stories and taking the videos, but we got very positive feedback from this on the recognition element and the value of a sort of formal way to recognize their work with clients and share the work they do with clients as well. Now, while the sticker intervention we thought was very promising, we weren't able to test this with a large sample because of various reasons, administrative mostly. But these were also important insights that we were able to share with the government counterpart for them to consider implementing in the future. What we did end up implementing was a simplified version of the social recognition intervention with over 700 social workers, where we rewarded good performance from social workers based on the assessment and feedback from their supervisors or their beneficiaries, and using kind of a set of preset objective criteria. Every quarter, one selected social worker would have their name and photo displayed outside of their office, which is a large government office, for everyone passing by to see, which would include their co-workers, as well as visiting clients. And what we tested, in addition to this potential impact of social recognition, is what source of social recognition matters. Is it the recognition from clients that they serve, or the sort of hierarchical supervisors who decide how well they perform and so on? We also had a third intervention here that focused on building growth mindset, but in the interest of time, I won't go into it. One thing I do want to mention is we complemented both of these sort of interventions with some clarity on the roles and the expected tasks that these social workers are supposed to perform, to sort of nudge them to allocate their time according to the relative importance of the different tasks that they perform. And between the two, what we found was that social recognition based on the supervisor feedback was more effective. So which meant this sort of hierarchical recognition matters more to them. But of course, the recognition then translates into sort of a social recognition because of the way they're rewarded at the end. And what we did find is that there are statistically significant improvements in job satisfaction, time spent on cash transfer program and its tasks, which was one of our main goals here as well as sort of interactions with beneficiaries and learning mindsets. And the interaction with beneficiaries part was important because this is one of the things that that a lot of these workers said inspired them to do their work, to actually get through the burdensome work that they do, and kind of these meaningful interactions was very important to them, and we were happy to see that this also kind of changed. So I'll stop here, and happy to take questions after if there are any. But just wanted to also say that what a big lesson for us with this project was not coming up with a solution right away based on kind of the immediate challenges that were identified by the government counterparts, but to really stop and think and look through, try out various types of diagnostic tools to really understand and unpack the problems that they face, so we can kind of effectively address them and address them in a way that matters to them as well. So thank you so much.
Great, thank you for that, Tasmia. Quite a comprehensive study. So we'll have some Q&A afterwards about that. Now over to Lucy, who will be introducing a bit of the projects, and then also introducing Daniela and Zabib. So over to you.
Thanks, Mary, and thank you for the opportunity to share some of our work today. So as part of the UN Behavioral Science Fellowship, we've been working on 2 projects that are relevant to today's session. One of them with the Food and Agriculture Organization's HR team, and the other one with the UN Geneva's Administration and Staff Union. And we're actually lucky to have colleagues from these organizations with us today, Zabib and Daniela. So what I'll do is, for each project, I'll briefly summarize what we did, what we found, and then I'll ask these colleagues to give us their own perspective and to have a bit of their concrete experience and hopefully inspire you to do something similar. So first, starting with a project with FAO's HR team. So in this project, we collaborated with the goal of using behavioral science to increase attendance at FAO HR trainings for employees on compensation benefits. So these are benefits for employees who had eligible work-related accidents or illnesses and who can receive compensation from FAO for that. And there is quite low attendance at training sessions about these benefits. And this is an issue because few employees know about or understand these benefits despite their potentially very high importance. And we thought that administrative burdens and frictions might be discouraging colleagues from attending these training sessions for a few reasons. First, to even know about the training session about these benefits, colleagues needed to find the announcement on the intranet of FAO, and then they needed to decide, is this relevant to me? Do I have time to attend? Do I have permission to attend, and so on? And then if they do want to attend, they needed to write down the date, the time, the Zoom link to the training, and then of course, they needed to remember to actually attend on the day. So quite a few potential burdens and frictions that could be discouraging colleagues from taking up this important training. So what did we do? As a team, we designed an intervention that consisted of an email calendar invitation that we sent to everybody covered by the benefit. The invitation made it easy to attend. Employees no longer had to find the announcement on the intranet or to remember any details or write them down, because they were automatically saved in their work calendar, and they also received an email notification. The invitation used simple language, a trusted messenger, the HR team, a clear call to action, accept the invitation now, a personalized message, we booked you a place, and it also removed uncertainty by providing information about what this benefit actually does and who it's for. And we tested our intervention using an experiment with 15,000 FAO colleagues eligible for the benefits. And what we found was that the intervention was highly effective. It increased attendance almost tenfold, from around 2% of colleagues among those who didn't receive the intervention to almost 20% of colleagues who did receive the intervention and got the email invite, calendar notification, didn't have to find it on the intranet, and so on. In real numbers, we had almost 2,000 employees attend our training, which is much, much higher than average for HR sessions or indeed any meetings and trainings in UN administration. And of course, the project helped increase awareness and understanding of administrative burdens across FAO. So now I want to ask to Zebib, a colleague from the HR Social Security team at FAO, what was it like for you and for the team getting involved with the behavioral science experiment, as an HR team? What do you think helped make the project a success, and how has it impacted the way that you work? And if you want to unmute yourself and turn on your video, and then really excited to hear from you.
Thank you, Lucy, and thank you, colleagues. I'm super excited to be here and to share my experience in application of the behavioral science in our outreach programs. To be candid with all of you, in the past, of course, we dedicated a significant effort and time to maximize the participation level in our outreach programs. But despite, our diligent endeavor and hard work, the outcome proved, disheartening and failed to reflect the extent of effort that we put into the process. So during the initial phase, we thoroughly examined the various domains that require intervention from the behavioral science. So I can say I approached the opportunity with enthusiasm and openness, particularly in piloting the outreach program that falls under the coordination of Social Security HR team in FAO. So however, I must admit that I do not anticipate, such overwhelmingly positive outcome from the application of behavioral science in the process. So what made the project or the pilot project a success? To be honest, fortunately, at the FAO, we have a dedicated team at the Office of Innovation who plays a central role in promoting, the significant importance of behavioral science across the different activities of the organizations, including administrative processes. So this has provided us with the opportunity to evaluate our operations through the BSc lens and perspective. So the pilot project received support from the senior management, including in HR. So they granted us the autonomy, to experiment, to modify, and to enhance our processes. So the leadership support, the involvement of the behavioral science expert, Lucy, thank you again. I take this opportunity to thank you. And also the collaboration with the Office of Innovation, Mary, Courtney, a lot of people were, part of the success through the process. And also the availability, the engagement with the subject matter experts. We in the social security were the subject matter experts that were the primary, factors for the success of the project.
And have the findings of the project impacted the way that the team works? Have you found that maybe changed your perspective of any other processes beyond the specific project on compensation benefits?
Definitely, because we learned a lot from the initial pilot project. So following the successful pilot project, we implemented also the behavioral science strategies in the various programs within like the social security, but on other topics like medical insurance, because we also do a lot of outreach and information sessions to educate people on the available services, different very important services, but people are not aware because they don't attend, the information sessions. So we have applied the behavioral perspective into our processes, into our communications. Like, for example, instead of relying on broadcast on the intranet, we utilized the calendar invitations and also incorporated behavioral informed languages. Now we are sensitive, in terms of shaping, tailoring our language whenever we send out invitations. So by consistently applying the BSS, the behavioral science lens in our work, in our communication, in our processes and other aspects, to be honest, we are able to replicate the previous success also in the different areas in social security.
That's great to hear, Zebib, and very inspiring to hear that even as a team whose primary mandate isn't behavioral science, you were still able to take on all these learnings and even apply them to other areas of work. Now,
definitely. Thank you.
Thank you, Zebib, again. Now, moving on to another project that we worked on as part of the fellowship, so this time with UN Geneva administration and the UN Geneva Staff Union. So this project now is one that is based on recent innovations in the behavioral science world on how to really quantify and measure administrative burdens around different work areas. So as part of this project, which we worked on together with Daniela, we wanted to understand a little bit more about what kind of burdens are faced by our UN colleagues across work areas and how it could, potentially impact our colleagues. And this is sort of a preliminary step in hopefully doing further projects, down the line, addressing the specific burden that we might identify during this project as potentially, excessive, or where we might actually, improve existing processes. So what did this project actually involve? Basically, we took a magnifying glass to processes that we had sort of heard already could be potentially burdensome to colleagues, and we tried to measure and quantify how it impacted colleagues. To do so, we designed and implemented a survey, which we shared with colleagues around UN Geneva, and we actually got responses from almost 1,000 colleagues. What we asked colleagues about was what sort of administrative burdens they faced in different work areas. So this included travel, recruitment, procurement, official correspondence, and flexible working-related processes. And so some of these might sound familiar because they've already been flagged by previous speakers as potentially burdensome areas for public servants. And we asked colleagues, what sort of administrative burdens do you experience? Complex processes, long paperwork, delayed permissions. Are they necessary in your view? How much time do you spend on them? How do they make you feel? And how do they impact your behavior, from having to do overtime to swapping between different priority tasks to even causing tensions at work? We've now received the data and we're currently analyzing the results, but it seems like we'll be able to identify quite a few sort of pain points in existing internal UN processes. Now, I wanted to ask you, Daniela, as an experienced UN administrator who sort of has had visibility over quite a lot of work areas, What was the motivation behind our project? So, how did you select the areas of inquiry, and what do we want to actually use the results for?
Thank you, Lucy. That's a really great question. And like everybody else, I'm rather excited to be here today and to really share some of our thoughts on why we did this survey. So to go back to your question, I have 18 plus years of experience in the UN and mostly in the administrative management areas. So I'm very well aware of our bureaucratic burdens our processes can present to people. And this is especially targeting sometimes those of our colleagues who work in these substantive areas. Those of us who work in administration, we provide services. Those of us that work in substantive, they're focusing on mandate delivery. So it's really important for them that they can spend as much time as possible actually on those mandated activities and are not bogged down by unnecessary administrative burdens. So when I learned for the first time about Professor Cass Sunstein's concept of sludge, I got really excited and I thought, this is something we should do in the UN Secretariat to really identify the biggest administrative burdens. And this is also going back to a lot of informal feedback I had gathered with colleagues from substantive areas where they would tell me how much time they would spend sometimes on these processes. And what's also clear here is we are a large organization. We have a lot of departments. So there's not only the official way of administration, if you will, but also every department also has an administrative section and adds another administrative layer on top of that, which is what our substantive colleagues often face. So having discussed and gathered informal feedback, it was clear that there are some areas where we would definitely potentially find more administrative hassle, because people talked about having to keep Excel shadow tables for some processes, having additional layers of approval necessary for others, where we know from the administrative side, it is not really possible and necessary. So this is why we decided to choose these areas that Lucy has already outlined. Typically the processes like travel and recruitment, these are very heavy processes, again, for the substantive areas. And we know that people face unnecessary burdens here. And what do we want to do with these results? It's clear we want to have good arguments when we approach senior management to say, these areas in particular are really posing, a lot of burdens, unnecessary burdens on our staff. And we would like to prioritize resources when it comes to business process improvements and other projects that we often engage in to improve the way we do the services, that these get prioritized. And we need this data to really, give a heavier weight to our arguments. So I think that we're really looking forward to have the final results, and we're very happy that 1,000 people responded. And we think we have an interesting story to tell after. And we also made sure that we teamed up with the staff union, because they're like the liaison with the staff, and they're very aware of many complaints that staff face. And they will also be very able to present the results to management. Thank you.
Thank you, Daniela. That's fascinating. And I think probably a lot of colleagues can relate to what you were talking about, and are really happy that, someone somewhere in the UN is starting to tackle this issue. Mary, I think I'll hand this back to you now.
Great. Thank you very much, Lucy, Daniela, Zabib, and Tasmia. We have a lot packed into the last few minutes there. Okay, so we have a quick tour of behavioral science and administrative burden across a variety of areas, internal and external to the UN. So we're going to go to some questions now in the Q&A. There are quite a few coming in. So going back to Elizabeth, I think there's some general questions about your work, and I guess behavioral science more broadly. It could be administrative burden, it could be outside. You mentioned you've run a large number of RCTs. So for colleagues, especially in the UN, as we think about RCTs, what are some insights you might want to share? And just to say from the UN side, when we mention the word RCT, there isn't always there's often an assumption that it's complicated and it's expensive and it's time. And so maybe what are some lessons you've learned, and maybe some insights around that for colleagues who are thinking about an RCT, but then a little bit hesitant? So what would you say to those points?
We could talk about this all day, Mary. So I'll try to keep it brief. I think you're right that, when randomized control trials started becoming a thing some years ago, in particular as part of development economics, the narrative was that, they cost $1 million and they take 5 years and they're very complicated. But that's not really about the methodology of doing a randomized control trial. That's about the outcome that you're trying to measure. So the reason those programs, those really kind of innovative, pioneering programs, cost $1 million and take 5 years is because they were trying to do something radical, large systemic change, and wanted to measure outcomes over time. Like what happens to children, 5 years later? What happens to young women after, a labor-intensive program, and then you follow them to see, their marriage rates. So it's nothing about the methodology that makes it costly and time-consuming. In fact, I would argue that it's much simpler and much less costly if you've set up an evaluation alongside the rollout of the program. Then you basically get the results as your program is happening. You're not doing an extra set of, evaluation surveys or focus groups or other kind of methodologies that can be really important, but also very intensive. So really it's about when you set up the randomized control trial that determines kind of how easy it is to use. If I said to you, private companies are doing kind of A/B tests every day on what the Uber platform should look like or what the Google website should look like, the results they're getting are kind of in real time. And so there's nothing kind of extra costly or time consuming about running a randomized control trial. That being said, they're difficult to get right. And the good news is the UN has invested in teams, both in-house and in collaboration with other units, to have that technical assistance, because the first time you do it, it does feel a little bit overwhelming. And over time, as we heard from Zabib, you can use those insights and adopt them in other parts of your work as well. And so what I would say is, if you're worried about trying one, talk to either the in-house teams at the UN or other teams like my team, or, there's many of us in the world that are specifically focused on doing these types of projects with government partners, because that's really the expertise that allows this to happen in real time.
Exactly. So much there, Elizabeth. And thank you for defining RCTs. I got so excited. I just mentioned those without defining what it is. Thank you. Okay, so great. And maybe another follow-up question for you as well. So you mentioned convincing policymakers to adopt evidence. That's a broad question at the end of your presentation. So maybe some more thoughts on that in the UN, sort of from our side, thinking about whether it's behavioral science, more general, how do we apply behavioral science, or how do we adopt this evidence that we've found from our study? Maybe some more insight specific to the UN there. That would be great.
Yeah, absolutely. So I guess there's two things I want to say. One is, until recently, this was not the problem to solve. Until recently, we didn't have a lot of evidence. But, you heard from Lucy and others, we've just had this explosion of really good, rich research, behavioral science and otherwise. And so now is the time to say, okay, what do we do with all these results? It's not that we were behind. It's just now that's the next behavioral challenge that we need to focus on. For me, partially because I love this topic, I also think about this as, within the framework of administrative burden. So policymakers and practitioners are behavioral beings like the rest of us. And so if we want them to take up evidence, we can think about it in the same way we think about all the other challenges we face. We need to make it super easy for them to do it. They need to know that the evidence exists. Academics have a big role to play in actually evaluating these programs on the outcomes that policymakers care about. So sometimes we like putting up treatment and control graphs, but really the outcome that the policymaker cares about is, how is this different for the poorest of the poor? Or what are the potential unintended consequences? What does this mean in terms of cost? And so we have a role to play as researchers to produce useful evidence, but then knowing that the evidence exists, making it easier to adopt it. So all the compliance hurdles associated with actually knowing what to do with that evidence and bring it to your context can play a role. And then I do think that there is a big challenge. I don't want to get too political right now around, trust in evidence and trust in science that I think all of us are facing. And so, what are the behavioral tools that we can use to make it more streamlined for policymakers is in itself a behavioral question that we're all going to answer. That's a long-winded way of saying I don't know what the right answer is, but it is very blatantly clear to me that just producing the evidence is no longer enough. And so that's really where we need to go next as a community.
Great, thanks for that. I think it relates to a number of the other questions with themes in them. So maybe we'll come to the other speakers now. Thank you for that, Elizabeth. So we have a few questions for Tasmia about her presentation. So we have one about explaining a little bit more about the methods used to carry out the behavioral diagnostics, and how did you convince governments or your partners to question their original ideas, kind of that side of things. And that's another one. For
I think
you.
I intended, I already responded
you
to
responded
one
to
of
it, okay.
Yeah,
So
online, but the
that one
second one I was actually about to type and I realized it's going to be a long answer.
Okay,
but on the methodology, I think what we primarily used, and which is typical for most of our diagnostic work, is qualitative tools like field observations, just unstructured or structured interviews, focus group discussions, etc. But I think in this case, what was a bit unique was because we had a very kind of open slate to start with. We spent a lot of time in the field. And this is important when you're working with the government, because initially they're going to paint the perfect picture to you. You want to spend a little bit of time so that they start getting comfortable. You want to go with them to the field for the whole day and see what they do. So that at some point, even without mentioning something, it kind of becomes obvious to you what they're experiencing and they start sharing. So I think for us, it was that is kind of separating it from just structured conversations, which is happening in front of supervisors where people aren't very comfortable sharing, to sort of accompanying them, splitting up and doing some of this. And so the combination of this really helped us kind of get some real insights from the social workers themselves on what challenges they were facing. But what we did was we did this repeatedly, and we kept reporting back to the government counterparts. And to the extent possible, we had them tag along, but not for the conversations we were having, so that they also understood, okay, well, these are challenges, like, things like a form that they have to fill out. We actually showed them how long it takes a person to fill out a form, and they realized, oh yeah, we don't need that, and so on. So I think to the extent you can include them, but also understand that, the presence of a superior is always going to affect the way people respond and talk about things. So keep those two things separate, but the combination of the two can kind of really help you get some buy-in. But I mean, we were also lucky, I have to say. Not all government counterparts are willing to even get to that point. And I think we had a more willing partner in some ways, not so much in some others.
Great, thanks so much for that context. It's always helpful. We read about, what is a diagnostic in our frameworks and our ideas about what is behavioral science, but it's always useful to hear the details about how you did that and how you actually worked with the government partner. Okay, so now on to Lucy and Zabib. A few questions for you. What are some of the biggest challenges you face carrying out this research project in FAO? So I guess just generally, what are the issues? You talked about some of the successes and the what you found, but maybe something around that. And then also from more specifically from a process or psychological perspective, how did your colleagues overcome that challenge? So yeah, we'll stop there for Zabib and Lucy. Maybe Lucy, did you want to come in first and then?
Sure, maybe I'll start with unexpected challenges, and then Zabib can talk more about the colleague perspective and sort of those internal dynamics. So I really wanted to say it was not what I expected that was the biggest challenge, actually, because as mainly an academic researcher doing a big policy project, 15,000 people experiment for the first time, I really thought the big challenge was going to be the behavioral science, designing the perfect experiment and getting the perfect statistical test and so on. But in fact, that was not the big issue. We were able to apply best practice. The team was really open to testing different solutions. The main issue was actually in terms of logistics. When you are implementing this sort of process, you need to become very, very friendly with your data team and your IT team, and you need leadership support, and all of these little logistical hurdles were actually what we spent the most time on, apart from designing and implementing the actual project. So I would recommend, if you're thinking of doing a project like this, it's really, really helpful to get buy-in like we did from very early on, so that if you need to get permission to access data, if you need, the IT team to let you do something crazy, like email thousands of people at once, then you won't run into so many issues. So that was a big learning point for me, and a huge factor to the success of the project, as Zabib discussed. And Zabib, do you want to say something about sort of relationship with colleagues and what it was like to get everyone on board and so on?
Thank you, Lucy. Yes, there were actually the challenges that we had from the technical perspective. Psychologically, like from the psychological perspective, like in order to initiate the change within our processes through the intervention of behavioral science, first, it was crucial for us, the implementers, the individuals, to adopt the appropriate mindset. That was the initial challenge. And like I mentioned previously, the leadership role has a huge impact in terms of embracing, a fresh approach in doing business, and fearlessly to initiate, changes into the normal practices that has been in the system for so many years. So embracing the innovation and empowering teams as we went through the process. As Lucy mentioned, we had a lot of technical challenges, but we didn't quit. We explored possibilities, way out. How could we address those challenges? How could we move on to make sure that we see the outcome? So psychologically, the readiness, the right mindset, it helped a lot. Thank you.
Great, thank you so much for that, Zavid. It's really interesting to hear from your side of things from FAO. Okay, so last we have a few questions for Daniela. I want to come back on. So there's one about, given your extensive experience in the UN administration, what do you see this potential for behavioral science application more broadly across the UN? And then also I might add this last one for you, because you mentioned partnerships near the end of yours. So with the staff union and others. So what kind of partnerships do you think are helpful and essential even to run these sorts of projects that you've worked on? And particularly, I don't know, sorry, maybe I'll mention as well, Daniela also has a PhD in psychology. So she has a bit of a researcher and practitioner stance too. So over to you.
Thanks so much, Mary. Yes, I'm very passionate about, behavioral science and social science. I really like the question, what is the potential for behavioral science in the UN? And I think it is large. Not only what we looked at in terms of administrative hassles, that's of course a huge area that we can explore across the UN. We all face those administrative unnecessary burdens. But I'm also thinking the way we communicate, the way we provide guidance. We have so many guidance, SOP, instruction documents, we send so many broadcasts, and many times the way they are written really do not make it easy for people to understand what they're supposed to do. They don't enhance the uptake of the information. So I think with simple behavioral science tweaks and tricks, if you will, we can really improve the way that we engage also with our personnel. And that's again, beside the whole area of administrative hassles that we can further explore. So I really think we have a lot of potential here. And I'm happy to see that this topic is gains more and more traction in the UN in general. In terms of partnerships, for us, it was clear that we shouldn't do this alone, this kind of survey. So for example, as in administration or the management side, it was clear that this is necessary to have a key partnership. And we chose the staff union again, because they have already key relationships with not only with staff, but also with management. They always provide a voice, they're listened to. So it's important, if you really want, those results to be carrying a voice, you have to build those partnerships. Ideally, you would get also a senior sponsor to come on board with such a project. We just said we're going ahead with, administration and staff union, but in hindsight, it would also have been good to have a senior sponsor from the start. But really, again, partnerships really help you, because afterwards, if you really want to address, the challenges you identified, you need those partnerships to be able to carry it through, I think. Thank you.
Great. Thank you so much, Danielle. And I really, across all the presentations and discussions, we've talked about partnerships, the buy-in, the different roles people are playing together to run behavioral science projects in this space. So really great, good note to end this session on. So I'd like to just thank all of the speakers and panelists for being with us today. Greatly appreciate your time being here, and great discussion with people around the world. So looking forward to continuing this throughout the week and throughout the upcoming years too. Thank you. Thanks, everyone.
Thank you. Bye.
Bye.